Hello, everyone, and welcome back to another episode of the Ash Podcast. Today's going to be a bit of a solo one. I'm just going to do, it's going to be a bit of a short one too. I'm going to be doing an article review like we've done in the past many times. But this is a good topic to talk on. So, starting out, this might sound small at first, but it's actually a pretty big deal. A few days ago, an article came out about New York joining a World Health Organization Global Outbreak Response Network. That is a mouthful. Sorry. After the US federal government pulled out of the WHO under Donald Trump. So, on the surface, this sounds very bureaucratic. Like, okay, a city joined a global health network. Like, what's the big deal, right? So, what? But when you zoom out and you kind of really think about this, there's a lot of huge questions that this story raises. So, first and foremost, it's about who gets to act in global health. What happens when nations or national governments step back, and whether cities and states are quietly reshaping global health governance. So, today I want to walk you through basically what happened, why New York doing this matters, and what this could signal for the future of global health, especially now that we live in a post-COVID, well, hopefully still and are going to continue living in a post-COVID world. We don't want any more pandemics. Um, just to preface, I will link the article in the description that I'm talking about. It'll be in the YouTube, Spotify, Apple, all the descriptions. And I'm not an expert in any of this. Yes, I have studied global health and have a master's in it, actually, but I'm not a well-read expert. I'm by no means an expert. So I may say things that are wrong that you guys might disagree with, might agree with too, who knows. But if anything I've said is either wrong or that you disagree with, please reach out to us. Feel free to let us know how we can do better, because that's all we're actually trying to do. So let's start with the basics. According to the article, New York has joined the WHO's Global Outbreak Alert and Response Network, also known as GORN. I apologize if I'm saying that wrong. It's kind of a weird acronym, GORN. So GORN is essentially a global health network of institutions, public health agencies, laboratories, universities, etc. All of these places then share their information, their expertise, and rapid response capacity during disease outbreaks. So think of, for example, COVID-19 that I mentioned already. In the past, we've had Ebola, cholera outbreaks after floods, new or emerging infectious disease, all of these things. And they work to maintain that, stop them from spreading. So now here's the key part. This happened after the US federal government withdrew from the WHO during the Trump administration. So while the country has stepped away, a city stepped forward. So New York City's NYC is now engaging, directly with a global health body outside the traditional nation state model that's been going on for years. That alone is unusual, to say the least. And this isn't just a symbolic gesture or a PR move, and it's not just something that's like a technical move based on that. New York has one of the largest public health departments in the world, major international airports, a dense population, deep experience managing outbreaks, like going back to again COVID-19, but also HIV/AIDS outbreaks. So by joining GORN, New York, NYC is essentially saying that we don't need to wait for federal government leadership to participate in global health. Actually, one quote that I want to speak out from the article is that the city has literally accused the Trump administration of compromising these countries' global health safety and preparedness to respond to future pandemics by pulling the US from UN agency. So they have outright said these things, which I think is amazing because these things need to be talked about when they're done because there's a global effect or at very least a nationwide effect that needs to be addressed. So, like I said, this is important because diseases don't respect borders. We saw that with COVID. Even if our political systems do, political systems are based on borders, based on differences. They clash. It's all temperament, human emotions, and a bunch of things going on at once that causes crazy decisions. A disease doesn't care. I'm gonna stutter while saying that, but disease doesn't care if we're fighting amongst ourselves. They're gonna disease is just gonna be like, okay, cool, you know, I'm gonna come in and infect more people. People might die. You guys keep squabbling regarding random stuff. So we saw this, right? During COVID, we saw delays, saw how nationalism and how a fragmented leadership cost lives. So this is an interesting move that's done by NYC because it suggests a different model where cities act as global health actors rather than the like on their own, rather than waiting for the federal government or the nation to act as a whole. So it's not just about implementing policy, but shaping it. I want to, so you might be thinking, what does this mean, right? So there is a bigger political context to consider. We have to talk about the elephant in the room. We, I don't love that phrase, but like it's funny. So the US pulling out of the WHO under Trump wasn't just about funding, it was about trust in multilateral institutions. In my opinion, this decision weakened global coordination, information sharing, and the US's credibility in global health leadership, which all in all is not a great thing. So in that case, New York joining Gorn is in some ways a quiet like correction to that decision. Again, this is kind of, I mean, I believe this to be true, but that is still at the end of the day my opinion. So there may be people who disagree with me and agree with the Trump administration and the decision to leave the UN based off of funding. But regardless of all that, NYC is a subnational actor basically saying that even if national politics are unstable, public health cooperation can't wait. Basically, to sum it up, being like, yo, we cannot wait for you guys to fix your squabbling and actually take care of the citizens. We're going to go do that. And this raises an important but uncomfortable question, which is that if these cities can bypass national governments in global health, what does that mean for sovereignty, or like lack of a better word? Like, where does it stop, right? Traditionally, global health governance is state centric. Countries talk to countries, and then ministries within their respective countries talk to the WHO, which is the overall governing body, uh, which is also governed by the UN, etc. Um, but this move by NYC kind of cracks that model, right? You're now looking at, well, there was this whole overarching sort of system organization that we've had for the last, I don't know, 30 years and beyond, that's been going on. Now we have a major city that's just deviated from that. It's not just like a tiny city in a small country that has political issues and maybe trying to rework how they look at their healthcare model. It is New York City in the United States of America. Now, arguably one of, if not the most influential city in one of the most influential countries in the world. So this is a big move by a big player. Anyone who understands, I mean, it's quite easy summed up, but that was a bit of a sports term and maybe also gambling. But regardless, all of these coming to a side, it's a question of what this can now lead to, right? It's not just about what is going on or how has it happened, but like what's the future, I don't know, consequences, benefits, harms, even like that. This can lead to a bunch of different things, right? Now, like I mentioned, New York, big city in US, one of the superpowers of the world, etc. Right? You have New York taking this step, right? If the NYC can do this, what is stopping other cities from doing so? And it's all dependent on the city and the nation. So, for example, Toronto decided that, okay, Canada's federal responsibilities regarding public health, or Canada's responsibilities regarding public health are not being met federally for the citizens of Toronto or Toronto. Let's just bypass that. Like, forget federal government. We're going to go straight to the WHO, and any outbreak issues, we're going to deal with it directly at a municipal level. Let's say London did the same. Let's say Sao Paulo did the same. Let's say, I'm trying to think of like big cities. Um, Lagos did that. What else is there? I'm Pakistani, so let's say Karachi did it too. Which Karachi doing might not be a bad idea. So I can understand where maybe this is seen as a positive for countries that are at a national federal level suffering politically and are suffering from corruption and other issues that lead to public health or outbreaks not being a primary concern for citizens of major cities. So those cities are like, okay, we're going to take it into our own hands. But like, where does that stop, right? So cities are where outbreaks emerge fastest, where health inequities are most visible, where responsibilities where responses actually happen. They usually start at that level because that's where you will affect the most people quickly, and then you move out into maybe the more rural areas where you're gonna have to go like, every couple of miles to find a small population and help them rather than find like 20 million people in one city. So we might be moving toward a future where cities form parallel global health networks, share surveillance data faster than national governments, and potentially pressure states to act. So they could force their own states and provinces to act, or in the other cases, just say, get out of the way, like get out of our way. We can do this better. We can do it ourselves. Why should the responsibility be with you? We can make it work for our citizens in our city. Just go deal with the rest of them, right? Like, we'll figure it out. And again, there are a lot of positives to this, but there are risks too. So not all cities have New York's resources. This could cause a lot of confusion. So like there could be cities that might try to follow New York's lead into this, but they need to understand you have to have the resources to protect the public health interests of your own citizens before you just take this step and sort of bypass the federal or the national level of your country. This could also deepen global and domestic inequities, where only wealthy cities get a seat at the table. So all of this kind of comes to a big question of, is this democratizing global health? I'm hoping that's a word, or fragmenting it. And I'd be very honest, I don't think there's a right answer right now. I think it's a wait and see if does this work out and which of those two results comes to fruition, and whether or not it could be a mix of the two, right? It could be a bit of both. And then we have to see if what the consequences are, and if this is an actual solution, or if this is just maybe one thing that someone did and maybe other cities shouldn't try it. So there's a lot of it just being up in the air right now of what this could mean. So kind of coming back to maybe why this matters for everyday people. This might sound abstract, but it affects you, me, and basically everyone, because faster outbreak detection means quicker responses, fewer deaths, less panic, hopefully, because we've seen that in cases of panic, nothing ever works out well, and better protection for vulnerable communities. It also reminds us that public health isn't just about science, it's about politics, and it's about trust, and it's about power, and all these things matter, unfortunately. I think it should just be about the science and the health of individuals and humanity and at a moral level, but there are unfortunately other factors. So it comes back to those kind of three questions that I alluded to earlier and kind of talked about, which is who gets to act? I think that's the first one. Who gets to act? Who gets to decide? And unfortunately, who gets left behind? Because that, while no one wants it to happen, it does happen more often than not. So yeah, like I said, this is going to be a short video, nothing too long. The article itself is not very long either. I will link it all. Just to sum it up, New York is joining a WHO network. Might sound like a footnote, but this is an early sign of a bigger shift, where cities take on global roles, where health corporations become more decentralized, where the future of global health might be shaped from the ground up, which could be a good thing, could be a bad thing. If you want to read the full article, I've linked it all down below. I'd love to know what you guys think. if anything I said is wrong, let me know where I could do better. If anything I said is right, feel free to give me compliments. I'll take them. Never gonna say no to that. Um, Agree, disagree, tell me I'm completely, lost and I've not don't know what I'm doing at all. I welcome it all, right? But feel free to do some of the research and build an opinion for yourself, and also think about from your perspective, even if you're not from New York, if you're from Toronto, from somewhere else, uh, would you want to see something like this in your future or in your city? And is this the future of global health government, or is this a workaround for potential political failure? I think that's going to be all. Thank you guys for listening. Please like, comment, subscribe on the video on YouTube. Share it on anywhere you can with anyone. We just want to spread some information, some knowledge. Hopefully, someone benefits from it. We get people talking about things that are important and current. You can find us on YouTube, Spotify, Apple Podcasts. I think we maybe will have some clips on posted somewhere. I'm not sure yet, but hopefully I'll see you guys in the next episode where we're hoping to get a guest soon. But otherwise, regardless, I hope I can see you all very soon in the next episode. Thank you so much.